Welcome to the Pro Aging Podcast. I'm Steve Gurney, founder of the Positive Aging community. We're thrilled to have you join us for interactive discussions with pioneers and thought leaders on a wide variety of topics related to aging and longevity. These insightful discussions and the Positive Aging Sourcebook are brought to you thanks to the support from our Positive Aging community champions. Visit proaging.com to connect with them and discover hundreds of valuable other resources. We're excited to have you with us today, so let's jump into an engaging Positive Aging live and interactive discussion. All right, folks, I'm excited today to have a discussion about mobile wound care, which is something that I've personally been seeing a lot more out there in the community. And to help me better understand this and help us better understand this, I've got Ashley and Andre today. Before we dive into this discussion, let's get to know the two of you. Ashley, would you like to go first?
Sure. So a little background on me. I've worked in skilled facilities. I've worked in home health and home care, and now I'm in mobile wound services. I absolutely love it. It's definitely been a great experience learning about all these services that patients can benefit from, not just wound care, but home health, home care, all of them.
Great. And what's the organization that you're with?
Advanced Mobile Wound Care of Virginia.
Okay, great. Now, Andre, tell us a little bit about your background and the organization that you represent.
Yeah, so I am with a company called Alternate Solutions Home Health. I've been in home health now about 15 years on the marketing side, so marketed to wound care centers, primary care doctors, excuse me, and DPM, so doctors of well, podiatrists, let's say that. And so I have a lot of experience with wound care. What my company does is we manage the post-acute care placements for patients leaving the hospitals. We partner with in this market with Inova Hospital. So I am the market manager for the Inova market.
Great. All right. Well, Ashley, back to you. Let's and both of you can jump in on this. Let's first sort of understand what wound care is, and then talk about the the aspect of bringing that wound care to the patient versus the patient having to go to a center or a practitioner.
So, wound care is something that has been happening in healthcare for years. There are a lot of patients out there that need wound care assistance. And over the years, we've come to realize that some of these patients cannot make it out to the wound clinics. They may not have a vehicle to get there. They may not have a family member to get them there. They may be bedbound. There could be lots of reasons that are keeping them from leaving their home, wherever that may be, to get to the clinic. They may even be an hour and a half away from a clinic, which would make it even harder for that patient to get there. Same with they may be in a skilled facility or an assisted living and may not be able to get out. That's where we come in and we bring the mobile wound clinic to them. So instead of them having to go out, we bring the clinic and everything that we can do to them, which is super beneficial for these patients that can't get out, especially for their family members who they're relying on to get them to the clinic.
And to kind of piggyback off of that, that's why why home health companies will utilize a mobile provider, because as Ashley was saying, if a patient is homebound, it makes it hard to get out. And homebound is actually one of the requirements for a patient to utilize and go on service with a home health company.
Oh, great. And then, and I guess we're kind of diving deep into this, but is mobile wound care covered under Medicare?
Wound care, yes, wound care is covered.
Mobile and
Yeah,
so
yeah. It
okay,
doesn't.
got it.
The fact that it's mobile, it doesn't really matter.
Okay, great, great. And then I understand that there's been some pretty cool technological advancements recently that uh you know it imaging and wearable monitoring devices that I imagine has also contributed to making this easier to provide in the patient's homes.
Oh, for sure. We do advanced biological placental grafts, which have come very far. Those are a growing thing that physicians are now using. Another thing that we use is an ultra mist debridement system, which is really big for these patients, especially the ones who can't handle the pain of a regular sharps debridement. So when you go into a regular wound clinic, you're getting a sharps debridement. They're scraping the slough off the top of that wound, which is super, super painful. Sometimes patients don't even want to go back because it's so painful. What we're coming in and doing is this ultra mist. It's contactless. It's held above the wound and creates a saline mist over that wound. And then it sucks all the bad bacteria out from underneath of the wound and all the slough off the top. So you're getting rid of more of that bacteria as well.
Man. All right. Well, Andre, your organization, you've got the patients, the home care patients that may need wound care as part of their treatment. Tell us a little bit about how this works on your end.
Yeah. So, excuse me. On our end, it works just as just like a patient would be going to a wound care center. So, a lot of the hospitals own also wound care centers, or the podiatrist may own a wound care center, or do just a wound care in their office. They'll have office days, um, and so if a primary care or somebody refers to the podiatrist or then to the wound care center, um, we will typically get the referral from from that referring center, right? Based on a few factors, but it's typically the amount that the or the frequency that the patient needs to be seen. Typically, a patient will go to a wound care center um, uh, Monday, Wednesday, Friday, or Tuesday, Thursday, just depending on how bad the wound is. But again, back to the very beginning, when patients are hurting that much from the therapy, they don't typically follow up. Typically, because of their disease states, such as diabetes or cardiovascular disease, they become uh, they are more likely to be non-compliant. So we'll work with their physicians, whether again it's the podiatrist or the or a wound care nurse at a center or in a doctor's office to initiate their treatment at home. Now, once we are in the home, then we can get a better idea of why this patient is either not non-compliant, or what other factors may be leading to them being non-compliant. And then we'll work with the patient. We'll work with the patient that way. So we'll order the supplies. We'll have a nurse out on a couple of day basis typically. Sometimes there is a family caregiver that can help with wounds, but again, the patient is typically they're going to be homebound. So if we need more help, then that's when we typically will work with the mobile wound provider as well.
Yeah, well, you really opened my eyes up to the challenge here is that individuals in pain dealing with with what can be very painful, having to get that person in a car, like whether a caregiver, family member, transport to a center. I didn't realize the frequency could be that great,
Yeah.
2 to 3 times a week. And this is really a service that is just tailor made to be delivered in the home versus in a clinic.
Yes, absolutely. Yeah. Absolutely. And a lot of times, um, the longer, I guess, the patient is at home, the more they're going to, the longer they're going to end up staying on service. And we want to shrink the time that they're on service. So that's where we, work with companies such as Ashley's, because we don't, it's not in our best interest to keep a wound care, and it's not in the patient's best interest either to have them on service trying to heal a wound for 2 or 3 months. So for some of the non-healing wounds, we will typically work with a mobile wound provider.
Yeah. This also, you've really gotten me thinking about non-compliant patients, which, quite frankly, are in every segment in healthcare. And
Absolutely.
the excuse that somebody can give to not going to an office or canceling any kind of office appointment is much easier than you are scheduled to have somebody come to your home on this day. So I really, I know the pandemic did a lot to sort of move us into more of a home-based medical system. But I think in this case, probably more than any that I've learned about, this really does make a lot of sense.
Yeah, and I'll say one more thing. Since the pandemic, there's been such a drain of knowledge base. A lot of clinicians have just left, and they've taken their expertise with them outside of the healthcare market, whether it's into their own private practices or just some kind of part-time gigs or some kind of administrative gigs. And and with wound care especially, you really need a specialist, right? You need a specialist who knows how to heal these wounds or has the technology to heal them. And our nurses are great, but a lot of them are not. We have a lot that are wound care certified, but they're not doing wounds every day. And that's where, again, working with a company like Ashley's really comes into play, and it really helps patients heal faster because they do only wounds. Their nurses and doctors are wound care certified. So, it really does help. Like they're specialists in everything, not only the wound, but getting the patients covered. They have a formulary that's really great. And so, yeah, it's a win-win for not only us because it can help keep our nursing utilization down, but also keep the patient, it'll get the patient healing faster.
I love it. And Ashley, you want to speak a little bit on that specialty of your team in your organization?
Of course, yeah. All of our team is wound care certified. They all specialize in wound care. So it's super helpful because they have so much knowledge in wounds in general that they're able to help those patients and help heal them very quickly. With their expertise and all the equipment and modalities that we provide, it is healing wounds so much faster than I've ever seen.
I love it. Man, well, you've certainly opened my eyes up to this segment, and I understand it a lot better now. Is there anything that we haven't chatted about on this topic that you'd like to share?
There's one more thing I would like to say. We work with so many different agencies. Home health seems to be our big number one, and the reasoning behind that is because we're able to provide them with orders to manage that wound when we're not in there. So that way there's multiple eyes keeping an eye on that wound at all times, making sure it's not getting infected, making sure those bandage changes are done, making sure those frequencies are staying up to date, making sure all those notes, everything's done. So that way it's healing very quickly.
I love it. All right. Well,
It's Can I add to that a
Yeah.
little bit, Steve? I'd like to, what I always like to stress is patient choice. So even if a patient is given an order and sent to a specific wound care, um, a, a doctor or outpatient facility, if they are not if they're not healing the way they should, if maybe they're not, something's just off, right? They don't like maybe they're not vibing with the providers. The wound isn't healing. Like they have options, right? So you're not stuck with care that you don't like. So I always like to remind people of that, because we all trust our doctors, of course, and our doctors are great, but sometimes they just don't know all of the choices that are out there. And I would probably guess if I asked 8 out of the 10 doctors I deal with, I bet you 8 of them would say that they didn't know about mobile wound care. So, if they don't
Agreed.
know, yeah, if they don't know, then, they're not giving their patients those options. So, yeah, a patient can always ask, hey, doc, I heard about this mobile wound care, or I heard about this. I'd like a referral. I'd like to give them a try. And, so patients should always remember that their health is their choice.
Yeah, I'm
I
great reminder,
love
Andre. And it is kind of shocking that there would be physicians in the market that wouldn't know all the choices for their patients. But
Right.
that's again part of the medical system. It's a lot of
Yeah.
these doctors' offices, they're like, you know, they're on the
Turning.
wheel.
Yeah.
And um but it's also a good reminder that not only like we always have choices, um there's alternatives that we might not be aware of in every healthcare sector, and just taking your time getting information. It's one of the reasons why the profession of patient advocate has become so
So
popular,
big.
is just
Yeah.
having a third party that to
Hmm.
bounce ideas off of as well. But great
Yeah.
reminder there.
Yeah.
Yeah, I
Absolutely.
I love that reminder, honestly, because I was actually at an assisted living today, and the marketing director there spoke briefly with me and stated that she loves having all these extra things for her residents, because if she didn't know what was out there, her residents wouldn't know either.
Yeah.
Yeah, absolutely.
Absolutely.
Great. Well, this has been a great conversation, and thanks so much. And I look forward to following up with both of you. And folks, all the contacts for Andre and Ashley are down below in the notes.
Awesome.
All right.
Thank you.